Did you hurt yourself playing golf, tennis, or other activities? Chronic pain? Call 561-600-HURT. Live pain-free. Call today.
I'm Dr. Melanie Rosenblatt, and you're watching Live Pain-Free.
There's the conversation in public about mainstream medicine and alternative medicine. Everybody says, oh, I'm going alternative, I'm going homeopathic. But you've incorporated both into your practice. Can you share a little bit about that with us?
I'm glad you brought that up. Actually, with osteoporosis, there is a medical supplement that we have that can help people who have thinning of the bones. But in general, people who have arthritis are looking for supplements that can help them rather than medications that maybe they can't take or they've had troubles with. There are a multitude of medications that are out there. There are also a multitude of supplements, and people get very confused. And in our practice, we like to take a holistic approach to the patient, and that would include supplementing your diet, supplementing with herbs, or with what's called a medical food, which is a prescription-based medication now that doctor does need to prescribe for you.
Why don't you tell us a little bit more about that, because that's something that's really on the horizon, and it's a very exciting field.
It is, it is. There is one that's out there that's called Limbrel, and Limbrel is a medication, medical food, that is used to help treat arthritis. And it is well tolerated in patients, especially those who are on blood thinners and people who can't tolerate oral medicines. It's wonderful for a lot of our elderly patients as well. And that's just one of the simple things that we're doing to augment people who have chronic arthritis and pain.
So let's talk about the patient that's watching, the person who's watching, because they're not really a patient until they decide to take some proactive action to come see you or see someone else. So now they're going, well, I think I'll go to a health food store. Oh, gee, there's a homeopathic place down the street. Let's talk to those folks and tell them really what they need to know. When should they make the decision to call you instead of trying to do something like that on their own? At what level should you say, you know what, that's not going to do it, come see a real doctor?
Actually, I'm glad you brought that up as well, because any patient that comes into the office, I encourage them to bring their supplements. Bring the bottle in, because you can't read half of what is in the bottle anyway, and we can tell them if that is appropriate for them or not. There are so many additives that are put into these that are not necessary, and maybe we can hone